Do you have a vaginal bulge, or do you experience vaginal pressure, a falling out sensation in the vagina? You may have noticed that you have to lean forward or lean back to completely pee, or you have to push up in the vagina to empty your bladder. You may have noticed you have more urgency, meaning a sudden urge to get to the restroom and you have to go really frequently. You start to wake up at night to go to the bathroom to pee, or you find that after you peed, you haven't completely finished. You've started getting maybe more frequent bladder infections. All of these things could indicate that you have a cystocele or a dropped bladder. Hi, it's Dr. Tugbiyele, board certified fellowship trained top doctor in urogynecology, and I've cared for thousands of women with a dropped bladder and cystocele over the years. And in this video, we're going to talk about how to fix a cystocele. In my previous video, I talked about what a cystocele is and how and why it happens. In this video, we're going to talk about how it's addressed and fixed vaginally. Now, for some women, pelvic floor physical therapy, getting the pelvic floor muscles stronger can be effective. And in other women, it's not, because getting those muscles stronger is not necessarily going to make the prolapse go back up into the vagina. And some women choose pessaries, which is a ring-like device to help to support the pelvic floor and the bladder back into its normal position. But for some women, they don't want to wear a ring pessary that they have to clean and put back periodically, remove before intercourse and put it back. There's just a little bit more managed things that needs to be maintained with the pessary. And so some women, it's not an ideal option. And when those two options are not ideal, then thankfully there are surgeries that can actually help put the bladder back in its right position and provide more relief of symptoms and a better quality of life. And that's what we're going to talk about. So this is a picture that shows normal diagram. And so this is the pubic bone here, tailbone here. So we're looking at a woman from the side profile, front and back. And this is the vagina in the middle, and the bladder's in the front here, and the rectum's in the back here, and the pelvic floor muscles are what go from front to back here and even side to side. And this is the uterus, and a woman who still has a uterus. So again, a side profile, this woman is sitting or standing, so to speak. And this is the bladder in the correct position, but here is the bladder in the position where it is dropped. So the goal of surgery is to take the bladder that has now dropped here compared to here and replace it so it's in its normal position, so it looks and feels more like this. So the way that a bladder prolapse is addressed vaginally is what you're seeing here, where this is a woman's bladder that has dropped. And so what we do, of course, a woman's asleep, and I tell my patients that you don't see, feel, or hear anything. And then what we have to do is open up the vaginal skin. Now, the issue is actually in the underlying connective tissue that you see here that's pictured or colored in blue, just to differentiate. It's not really blue, but it does to differentiate the layers. And so, again, a woman's asleep, you don't see, feel, or hear anything. The vaginal skin is opened, okay, and that reveals the underlying connective tissue, and the underlying connective tissue is repaired using suture material or stitching, and that's to stitch the connective tissue and to strengthen that layer of the wall, and the excess vaginal tissue is trimmed and then it's put back together again. So again, this is a blood that has dropped, right? We open up the vaginal skin, repair the underlying connective tissue using suture material or stitches, and that progressively in layers puts the bladder back in the right position. We trim out the vaginal tissues and then re-approximate it. So you see these underlying connective tissue layers repaired and restored and strengthened using suture material, and then the vaginal tissue is repaired, restored, and put back in the right place as well. So that describes how a cystocele is addressed surgically vaginally. Now, in terms of recovery, the vast majority of women go home the same day since it's a vaginal outpatient procedure. And when a woman gets home, walking and stairs are fine. I usually advise my patients to think about recovery in stages, so to speak. In 2 days, 2 weeks, and 6 weeks are the milestones. 2 days, 2 weeks, 6 weeks, or 6 to 8 weeks. So 2 days, 2 weeks, 2 months. So the first 2 days when a woman gets home, again, walking and stairs are fine. Back to driving after the first 2 days, once the swelling goes down, and then you're able to empty your bladder well and actually be able to go comfortably and drive. That's the indication that it's okay to drive. A lot of women in about 2 days are no longer taking for discomfort. The swelling's down and able to drive comfortably after that point. Showers are fine. However, we do not want those incisions, even though they're internal vaginally, those incisions are not meant to get soaked. So no bathing, jacuzzi, hot tub, swimming, any of those things. And then, yes, stairs are fine, but no running, no exercise, nothing strenuous. After the first 2 days, if you have to shopping, drive to the groceries and get something, as long as you're not lifting anything above 10 to 15 pounds. Now, a gallon of milk or a gallon of water is about 8 pounds, nothing above what would seem like a gallon in each arm. And then I tell my patients in about 2 weeks, typically every woman feel great on the outside, but there's a lot of healing going on the inside. Even though you're driving, you can go shopping, run an errand. A lot of women are able to turn back to work depending on the type of work after about 2 weeks. Still nothing strenuous like exercise, gym, heavy lifting. I tell my couples, nothing inside the vagina, meaning no intimacy inside the vagina until after all the sutures are dissolved. And that's typically closer to 6 to 8 weeks, so 2 months. And after about 6 to 8 weeks, so 2 months, then typically the sutures have dissolved. And then women at that point are able to return back to their usual activities without restrictions. So 2 days, 2 weeks, 2 months in terms of recovery. And so, in summary, cystocele or bladder drops are common. They affect many women. Thankfully, they're good, effective solutions and options to help women feel better, improve her confidence, comfort level. And if you're a woman who is listening to me, you may have tried pelvic floor physical therapy and that hasn't been helpful, or you may have tried a Pessary and that hasn't been helpful, or those are not ideal options. Thankfully, again, they're effective, safe solutions nowadays. Of course, no one wakes up in the morning and says, oh, I want surgery and I want to go see a urogynecologist. However, if it looks like that's the next best step, then thankfully there are options and effective surgical solutions like I just described that help women. Now, being a board certified fellowship trained urogynecologist and top doctor of urogynecology in Atlanta, care for thousands of women successfully, safely, and I'll improve your confidence, your comfort level, and your quality of life. And if you're looking for a urogynecologist who will listen and who has the surgical expertise to address the problem effectively, then I invite you to work with me. One of the 2 ways you can reach me is on my website. That's drtugbiyele.com. You don't have to memorize it. It'll be in the description or in my bio. And from my website, there's an inquiry form that you can fill out and that'll reach my team and they'll reach out to you to schedule a consultation. Or you can call my office directly at 470-325-1280. And that'll again get to my office and they'll be able to schedule an appointment for you to see me. And if this video has been helpful, please do like, share, and subscribe to my channel so that when I create other videos, you'll be the first to know about it. And when you share it, another woman who has probably been putting up with it, they're embarrassed, they don't want to talk about it, they think they're the only ones, that they don't know about the solutions that are available, she'll be so thankful and so grateful that you share this video. And again, if you're a woman who's looking for a urogynecologist, I invite you to work with me. Imagine how you will feel when you no longer have that bladder drop or prolapse feeling, that pressure, not being able to empty your bladder completely, or the recurrent bladder infections, the discomfort with intercourse due to that bladder drop or the urgency. Yes, all these things are possible for you when you work with me. And so I invite you to work with me and I'll see you in the next video.